Professor, yeah.
Okay, Professor. Okay. Hi, Professor Gribben. Thank you so much for attending the interview today. So our first question for you is that, first of all, congratulations on winning the José Carreras Award this year. The José Carreras Award is one of the most significant awards in the field of hematology, given annually to researchers who have made significant contribution to the field. First, would you please introduce your outstanding research treatments and share your feeling about the winning the award?
Well, thank you very much for the kind words. Yes, I'm very honoured to have been the recipient of this year's José Carreras Award. José Carreras, of course, was a very famous opera singer, but he's famous in the field of hematology in that he received an allogeneic stem cell transplant. Very famous, develops leukemia and undergoes this transplant. It brings a lot of press attention to the whole field. Since then, he has done a great deal of work setting up a charitable foundation which gives funding and awards to research in hematology, including, of course, this award at EHA. And I'm very grateful to the José Carreras Foundation for supplying the award. The recognition of the field of the work that I worked in was in the field of immunology of treatment of hematologic malignancies. My research has focused on why is it that cancer patients, and particularly patients with cancer with hematologic cancers, do not develop an immune response against their own cancer. A lot of the work we've done has demonstrated that the acute leukemia or lymphoma cells can suppress the immune system. And by understanding the mechanisms whereby that immune system is suppressed, we've been working very hard to find ways in which we can reverse that to use the immune system to aid in the fight against cancer, which of course is now exploited in things like bispecific antibodies and CAR T cells, which have now become mainstay. But of course, during the time I've been doing this work, we've gone from having nothing to having many, many ways in which the immune system is now used to fight cancer. So it was very nice to receive this award in this way.
We found out that at this conference, you also served as the chairperson for one section. Could you share some of the highlight of this section?
So I chaired a session that was with the Lymphoma Foundation, which is a patient advocacy group. During the time I was the EHA president, I worked very hard with the patient advocacy groups to increase what we call patient power, so to increasingly hear the voice of the patient. And we set up a patient advocacy committee within EHA, and they now have their own track and whole session of meetings there. The meeting I was chairing was looking at relapse refractory chronic lymphocytic leukemia, and it was thinking about how we can integrate the biology of the disease, the treatment approaches that we have, and the patient's wishes to be thinking about how we can best integrate all of those issues together to be coming up with the treatment approach which best suits the patient. Now, we're in a fortunate position now with chronic lymphocytic leukemia that we have multiple choices that the patients can have. And I think it's increasingly important that we listen to the patients and their voice as to which of the various treatments that may be suitable for them they would most like to have. Now, to do that, of course, you also have to provide the patients with information about the disease. And of course, in chronic lymphocytic leukemia, where we don't, unlike acute leukemia, have a patient who comes in, gets diagnosed and needs treated the next day, we have time to educate the patients about their disease and about its treatment and involve the patient's voice. And what research is increasingly showing is that the more the patient is engaged in that process and the more committed they are to that treatment, the better the adherence, the better the quality of life, and therefore it is an important component of how we should consider doing this. So I was particularly proud to chair that session because I really feel very strongly that listening to patients' voice is very important.
Yeah. It's also about the research you published this year, the P1666, right?
Yes,
yeah.
Sure, okay.
Okay, it's the same thing we're talking about. So currently the field of hematology is undergoing robust development. So what efforts should we make to further promote global cooperation and exchange?
I think this is a hugely important issue. We do not want to be having to reinvent the wheel and go back to repeat clinical trials which have already been done. We're certainly used in the West, where there's been historically a lot of collaboration, particularly between Europe and the United States, for us to work very collaboratively together. And I think what we have seen in the globalization of medicine, and of course the emergence of China as a power in terms of development, we talked a little bit earlier about CAR T cells, where China is doing absolutely fundamentally important work. I think it becomes more and more important that that globalization involves the whole. While I was president of EHA, we had very close associations with the Chinese Hematology Society, and those are kind of examples of how we're doing it. But we need to broaden it beyond that to look how we can share scientific knowledge, how we can share clinical trial knowledge, and how we can take advantage of doing this. Certainly, historically, clinical trials in the West have involved patients who were from the West. And there's an increased realization that your own ethnic background and your DNA and your gene profile may be very important and may not produce exactly the same results and exactly the same toxicities that we see when we do trials in the West. Have, of course, more movement of people living in different countries. We get some experience of that. But certainly I've seen a lot of interesting research coming out of China, for instance, recently, looking to see, are there differences, in fact there are, differences in things like CLL in the West compared to in the East, where we can compare and contrast, and also to try to understand why those differences may arise. That also comes back to this issue of then finding the right treatment for the patient, and maybe the ethnic background of a patient that we try to think shouldn't be important in our decision making, maybe scientifically it is important and should be a consideration if, for instance, it turns out that there are some side effects that are more common. That can only come from us having increased collaboration to be able to identify what those differences are. Exactly. So if we open trials that are then open also in China, we're then going to have a lot of patients from the Chinese ethnic background included in the trial, and we can then look to identify whether there are differences. There are drugs which are important in some areas but not in others. And the more work we can do collaboratively, the more we can identify exactly what those changes are.
Thank you so much. Yeah, we have finished all the questions right now.
Thank you.